Gentlemen, your body hides 3 reflex points that can raise testosterone, improve circulation, and strengthen immune defenses against HIV. In 2024, about 1.3 million acquired HIV and roughly 630,000 died. Progress, yet a reminder that prevention matters. I'm Dr. Jame, urologist and men's health specialist with 20 years focused on HIV and hormones. Low testosterone tracks with higher inflammation and weaker immune readiness, increasing vulnerability during risky exposures. Can pressing 3 points shift your hormones and defense system in under a minute without pills? Today, I'll show the exact map and a 60-second routine you can practice. If you're interested and this helps, comment 1. If not compelling yet, comment 0. Every comment helps one more man see this. This journey needs you. One small subscription, big impact. Help us reach 1,000 and spread something positive. For men aged 18 to 60, navigating fatigue, stress, low drive, or post-infection burnout, this session focuses on awareness and self-care. It does not replace diagnosis, individualized treatment, or clinician-guided medical evaluation. Take notes as we go. These simple reflex points can strengthen circulation, nudge testosterone, and support immune readiness. Beyond energy, they help reactivate your confidence and control in daily life, evidence-informed. Give me 60 seconds to show how testosterone and immunity are silently linked. I've devoted my career to this intersection, and what follows condenses lifelong research into steps you can use today. Testosterone is not just about drive. It modulates immune signaling, supports CD4 helper cells, and stabilizes inflammatory pathways shaping your response to threats. When testosterone dips, cortisol rises, diverting resources from frontline defenses and leaving you more susceptible during stress, sleep loss, or recovery after illness. That shift can mean slower antibody responses, more frequent minor infections, and a body that feels tired even when labs look normal. Think of testosterone as a conductor. It coordinates vascular tone, nitric oxide, and cytokines, so tissues get oxygen and immune cells arrive where needed. Lifestyle pressures intensify the loop. Overwork, alcohol, ultra-processed foods, and inactivity elevate cortisol and push testosterone lower. Poor sleep shortens REM cycles and reduces luteinizing hormone pulsatility, shrinking the nightly window when testosterone rises. Chronic stress tightens pelvic and lower back musculature, restricting circulation to organs that depend on steady blood flow for hormone signaling and immune surveillance. The good news is that small, repeatable inputs can redirect this system toward balance without dramatic interventions. Breathing drills, morning sunlight, protein-rich meals, and micronutrients like vitamin D3 and zinc help restore the hormonal rhythm that keeps immunity alert. Many men still need a tactile cue usable anywhere, something that engages nerves, opens vessels, and settles cortisol quickly. This is where reflex work becomes practical. Targeted pressure on specific points can enhance circulation, trigger parasympathetic calm, and support endocrine immune dialogue in real time. Hold this framework because next we'll map 3 reflex points and integrate a focused 60-second routine today. We've reached the practical core, and you heard me correctly. Few physicians teach this, yet minutes today can unlock surprising changes in circulation, hormones, and confidence. Mini hook. These 3 points have been studied for blood flow optimization and hormone activation, and they give you a precise, repeatable lever to influence physiology safely. Point 1. The sacral region in the lower back influences pelvic vessels. Gentle pressure here enhances circulation, eases guarding, and supports testosterone release via signaling. To locate it, place your fingertips just above the tailbone on either side of midline. Feel the firm plate and apply slow, comfortable, perpendicular pressure. Breathe through your nose for 5 counts, exhale for 5 counts, and allow warmth or pulsation to guide whether the contact is adequate or excessive. Point 2 lies along the inner ankle, just above the medial malleolus. Circular pressure supports lymphatic drainage, reduces congestion, and steadies immune balance during stress. Use the pad of a finger rather than a nail. Maintain steady contact and scan for tenderness. Moderate sensitivity indicates you've found the fascial window. Point 3 is the perineal point between scrotum and anus. Gentle contact stimulates pelvic nerve clusters governing function, reflexes, and autonomic regulation supporting immune coordination. For hygiene and safety, use clean hands and external contact only. Avoid insertion or aggressive pressure, and stop if numbness, sharp pain, or discomfort appears. The basic sequence is straightforward. Locate each point, apply comfortable pressure 30 seconds, breathe slowly through your nose, and release while observing warmth or ease. Consistency matters more than intensity. Daily sessions teach your nervous system to downshift, reduce cortisol, open vessels, and create hormonal environment that favors testosterone signaling. Because this method is tactile and non-pharmacologic, side effects are minimal when you respect comfort thresholds, stay present with breathing, and avoid pressing irritated skin. If anxiety rises, shrink the pressure, lengthen the exhale, and remind you are training a reflex, not forcing it. Reassurance lowers noise and improves outcomes. Pair the practice with anchor habits, after brushing teeth, finishing a shower, or before sleep, so repetition wires the brain and you miss days when schedules crowd. If this section has helped you, leave a comment. If it hasn't yet, offer feedback so I can earn your trust with next content. With fundamentals established and safety clear, we can map all 3 points together and, in the next section, assemble a focused 60-second routine you'll use. Don't stop here. Listen closely, because this is the hinge that makes Reflex work credible and practical for men's health, performance, and HIV-related immune protection. Steady, comfortable pressure activates mechanoreceptors that trigger a nitric oxide pulse. Nitric oxide relaxes vessels, opens microcirculation, and improves oxygen delivery to hormone-sensitive pelvic tissues. With blood flow restored, sympathetic guarding eases, muscles release, and perfusion shifts toward organs that require steady delivery for endocrine signaling and real-time immune surveillance. Endocrinologically, tactile input modulates the hypothalamic pituitary gonadal axis. Calmer autonomic tone steadies GnRH, supports pituitary LH, and helps Leydig cells convert cholesterol into testosterone reliably. Lower autonomic arousal trims cortisol spikes, reducing inflammatory noise that blunts immune vigilance and raises vulnerability during sleep loss, stress, or recovery from illness. Lymphatic activation matters. Rhythmic pressure plus diaphragmatic breathing act as a pump, moving interstitial fluid, clearing metabolites, and improving trafficking of CD4 and other frontline immune cells. In practice, men report warmer hands, easier erections, arousal cues, and steadier morning energy after 3 weeks, consistent with better microvasculature and less pelvic tension. Athletes apply similar physiology, brief targeted pressure and slow breathing between sets to restore parasympathetic balance, accelerate recovery, and keep hormonal output stable across long cycles. My patients use these methods during travel, work breaks, or pre-sleep routines, choosing 30 seconds per point, gentle contact, and long exhalations to signal safety to the nervous system. If lightheadedness or pain occurs, reduce intensity, shorten the session, and return when rested. Reflex training should feel steady, reversible, and never forceful, heroic, or punishing. Track 3 markers to verify change: morning erections, daytime energy steadiness, and nightly stress ratings. Improvements often cluster between day 14 and day 21 with consistent practice. Now, let's turn this mechanism into a daily plan. 60 seconds linking breath, pressure, and attention, so you can practice anywhere and translate physiology into results. The 60-second secret is here. Congratulations for reaching this point. Now please take notes carefully. I want this next minute to become part of your daily rhythm, not just something you watch and forget. Start each session, morning before the shower or evening before bed, by sitting comfortably, spine upright but relaxed. Press each reflex point for 30 seconds while following a deep, slow breathing pattern. Sequence matters. Lower back first, then inner ankle, then perineum. Finish by stretching your arms overhead, rolling the shoulders and allowing a wave of relaxation to move through your chest and abdomen. The sacral pressure opens pelvic circulation, the ankle clears lymph channels, and the perineal point resets pelvic nerves. Together, they modulate blood flow, oxygen delivery, and the hormonal messages that tell your body to produce testosterone efficiently. You're combining mechanical stimulation with neuroendocrine balance, something drugs often miss because they treat only chemistry, not rhythm. Pair this with foundational supplements: vitamin D3 for immune signaling, zinc for testosterone synthesis, and omega-3 fatty acids for cell membrane stability. They're simple, evidence-supported nutrients that amplify the reflex response and accelerate recovery from daily stress. Nutrition still anchors everything. Prioritize lean proteins, eggs, fish, beans, and healthy fats from olive oil or nuts to give your body the raw materials hormones require. Limit processed sugar and alcohol. Both elevate cortisol and blunt the very signals you're trying to strengthen. Integrate a short mind-body cue. As you exhale, repeat silently, "I'm restoring balance and strength." This affirmation calms the limbic system, lowers heart rate, and turns focus inward, so pressure becomes meditation, not tension. If dizziness or pain appears, stop immediately, breathe, and restart lighter the next day. Progress depends on consistency, not force. After completing the routine, record one observation: warmth, energy, calm, and post a comment saying, "Se tuk hien." Share your 30-day progress. Your feedback helps refine the next protocol and encourages another man to begin his own 1-minute recovery. Real stories help you visualize what you have heard. I want you to see how physiology shifts when small, repeatable behaviors are practiced with intention. Evidence first. Reflex-based manual stimulation has shown modest testosterone increases in small trials, typically in the 10 to 15% range for men with mild deficiency. The proposed mechanism combines improved microvascular flow, reduced autonomic arousal, and steadier hypothalamic pituitary gonadal signaling. Stress management matters just as much as pressure technique. When we reduce sympathetic drive and lower cortisol peaks, immune vigilance improves, inflammatory noise quiets, and endocrine messages become clearer. The result is better readiness under everyday strain, fewer dips after poor sleep, and more reliable hormonal output. Now, the case. Michael, 42, a product manager and father of 2, presented with chronic fatigue, low morning energy, and inconsistent arousal cues despite normal routine labs. He was not on testosterone therapy. We implemented the 60-second reflex routine twice daily for 4 weeks, paired with vitamin D3, zinc, omega-3, breath pacing, and a protein-forward breakfast. He tracked morning erections, midday focus, and nightly stress ratings. By week 2, he reported warmer hands and easier morning arousal. By week 3, subjective energy stabilized and evening irritability declined. His wearable showed improved heart rate variability and slightly lower resting heart rate. At day 28, labs reflected a mid-range total testosterone rise from his personal baseline, consistent with a modest 10 to 15% gain. His CD4 count, previously stable at the low normal range, nudged upward within normal variability, matching his improved sleep and stress metrics. Importantly, nothing felt extreme. Sessions were comfortable, reversible, and anchored to daily habits, which is how physiology learns new rhythms. He kept alcohol modest, limited added sugars, and protected 7 to 8 hours of sleep. This is not a miracle. It is a systems approach that stacks small inputs and measures the outputs you can feel and verify. That is why adherence wins. As we move forward, keep tracking your 3 markers and build repetition. Small habits create major shifts in your biology and in your confidence. After 30 days of consistent practice, men commonly report steadier morning energy, clearer focus, calmer mood, and reduced background anxiety. Circulation feels easier in the pelvis and lower back, breathing deepens naturally, and small stressors no longer hijack the day. Morning arousal cues reappear more reliably, a simple indicator that hormonal rhythm and vascular tone are aligning in a healthier pattern. Workflows become smoother because attention holds longer, transitions feel lighter, and small decisions cost less emotional and cognitive energy. Partners notice patience returning, conversations feel safer, and confidence replaces the quiet fear that had been building in the background. Sleep improves as the nervous system trusts the nightly downshift. Recovery deepens, and you wake restored rather than depleted. Self-respect rises because you are keeping a promise to your body. Action replaces worry, and momentum replaces hesitation. This is emotional rebirth, shifting from fear to informed control, from passivity to participation, and from shame to practical self-care. You learn to interpret signals, warmth, ease, clarity, so feedback guides tomorrow's practice, making progress feel both visible and scientifically grounded. Social confidence grows because stability inside your body reduces reactivity. You carry steadiness into relationships, intimacy, and difficult conversations. True strength isn't just muscles, it's knowing you can help heal your body naturally with breath, precision, and consistent attention. As a physician, I want your wins measured and repeatable. That is how resilience becomes habit, not an occasional good day. Keep anchors simple. 60 seconds daily, protein-forward meals, sunlight exposure, and protective boundaries for sleep, alcohol, and inflammatory foods. If you miss a session, restart gently. Physiology learns from pattern and kindness, not punishment, force, or perfectionistic pressure. You are ready for the final step. Let's convert these gains into a 4-week plan that protects progress and scales results. Next, choices matter more than motivation. We have reached the part that turns insight into action and action into results. I want a plan you can follow without friction, verify with simple markers, and keep for life. Week 1. Learn the map and practice locating the 3 reflex points daily. Use gentle, consistent pressure, 30 seconds per point, paired with slow nasal breathing. Note warmth, ease, or clarity as immediate feedback assuring you are within a safe therapeutic window. Week 2. Add vitamin D3, zinc, and omega-3. Keep doses within your clinician's guidance, stay hydrated, and anchor the routine to morning or pre-sleep. Protect sleep windows and limit alcohol so hormones have the ingredients and the rhythm to peak. Week 3. Track energy, mood, and libido. Capture 1 line each evening. Stable mornings, calmer afternoons, and steadier arousal cues mean the endocrine immune conversation is getting clearer and your system is learning a healthier baseline under real-world stress. Week 4. Evaluate changes honestly. Keep the daily 60 seconds. If progress is partial, adjust pressure and breath pacing. If strong, maintain and share what helped you most. Consider pairing the routine with short daylight walks to reinforce circadian signals. Mind plus body synergy is the principle. Reflex pressure, breath, sunlight, protein, and micronutrients teach your system to lower cortisol, open vessels, and support testosterone while keeping immune readiness high. Small, repeatable inputs build momentum faster than occasional heroic efforts that cannot last. Join the Healthy First Hub, comment your progress, and subscribe for next Reflex Map video. One subscription today can move this message to the person who needs it tomorrow. We are moving toward 1,000 companions. Thank you for standing with science-based, stigma-free education that meets men where they are. When you implement, return to this video and report your results. Your story can motivate another man, and I may borrow your example with permission to help even more people act earlier and wiser. A small subscription today can carry this to someone who has been searching in silence. Your body holds the code to strength. You just need to press the right points.